Now I'm about to talk about the different types of psoriasis that we have. There's different types of psoriasis that will occur. So we'll talk about the plaque psoriasis, talk about the guttate psoriasis, talk about the inverse psoriasis, talk about the pustular psoriasis, talk about the erythrodermic psoriasis. Okay. So the most important thing is what? The pictures. Plaque psoriasis, inverse psoriasis. This one is a sober psoriasis, erythrodermic psoriasis, nail psoriasis. Another picture. So let's look at it. So plaque psoriasis, is also known as what? Psoriasis vulgaris. It's the most common form, and over 80 to 90% of cases of psoriasis you see it. So the appearance is raised, red patches, it's covered with silvery-white scales. The location is usually the elbow, the knees, the scalp, the lower back. It can be itchy, causes burning, and causes skin cracking. So causes is chronic and relapsing. The next is the guttate psoriasis. It's more of like patches here and there. So mostly it's triggered due to streptococcal throat infection. So you have numerous small drop shape, that's guttate, red spots with fine scalings. Location is usually in the trunk, in the limbs. Population affects children and adults more. So inverse psoriasis now, okay. It's smooth, it's shiny, red lesions. So usually affect the skin folds. So symptoms is painful, it can be irritated by friction and also sweating. Okay. So it can be mistaken for all those fungal and also bacterial infections. Then we have the pustular psoriasis. Okay. Pustular psoriasis. Alright. They appear to have some fluid inside that you can even break. Okay. So appearance is a white pustule, So forms is localized, usually found on the palms, on the soles, sometimes generalized. Okay. Then erythrodermic psoriasis. Erythroderma, Okay. So erythrodermic psoriasis just simply means there's a widespread fiery redness, scaling and shedding of the skin over large areas. So there's a lot of itching, there's a lot of pain, there's a lot of swelling, and temperature dysregulation. So it could appear on the body, and there's risks of infections, there's risk of dehydration, and also heart failure.